chronic kidney disease C.k.d. It is progressive reduction in the GFR, that is the filtration capacity of the glomeruli of the nephron in the kidney. It is a chronic disease, hence it is irreversible and incurable. In this disease, the normal GFR, that is glomeruli filtration rate, is decreased below 90 ml per minute, whereas the normal range of capacity is 120 ml per minute. So, due to various causes which produces reduction in the capacity of the glomeruli to filtrate the blood of the human body, the result is the reduction in the GFR. The various causes, the main is that is diabetes, type 1, type 2, mostly it is the type 2 diabetes, hypertension, autoimmunity, the diseases, that is the lupus and the rheumatoid arthritis. Prolonged use of NSAID drugs, they also damage the inner lining of the endothelium of the glomeruli, that is the capillary which filtrate the waste product of the blood and passes out in the form of urination. When it is divided into two phases, acute phase and the chronic phase. Acute phase, when the capacity of the glomeruli suffers but is reversible and curable within the period of 3 months. Whereas in chronic phase, the disease is progressive, irreversible, incurable, and it passes beyond the limit of the 3 months. So it is a progressive, slowly insidious process of pathology in the filtration capacity of the glomeruli. The disease is classified into acute and chronic kidney failure or the kidney disease. The chronic C.k.d., that is chronic kidney disease, is further divided into 5 stages or grades from 1 to 5th one. When the GFR falls below the 90 ml per minute, it starts from grade 1 and onwards. When it falls below 15 ml per minute, then it is the final stage or the acute failure, that is the complete failure of the kidney. So at this stage, dialysis is to be performed, is compulsory to save the life of the patient. The dialysis is the process by which we use a mechanical machine and the blood passes through that machine, and there the waste products are extracted, and the blood with fresh oxygen and the purified form is re-entered in the body of the patient. So the various products which are produced by the metabolic process of the body, of the various organs, that is excreted not by the kidney but by the artificial kidney which is installed outside the body of the patient. So it is of two types, that is hemodialysis and the peritoneal dialysis. And then further, it is a temporary procedure. We have to transplant the kidney of the patient from a healthy donor so that the normal kidney should be operated and is transplanted in the patient for the normal life of the patient. So these procedures or the process, that is dialysis and the transplantation of the kidney, is necessary when the final grade, that is fifth grade, or the final, the grade stage of the chronic kidney disease is attached or approaches. When the onset of the chronic kidney disease, C.k.d, is at the final stage, then there is only one procedure, that is the dialysis and subsequently the transplant of the healthy kidney from the healthy donor into the patient to save the life of the patient, to purify the waste product of the blood of the patient, so that the normal urination process is maintained for the maintenance of the life of the patient suffering from CKD.